Welcome. I'm here today with Dr. Jeff. He is one of our speakers for My Arrival 2-Day Women's Retreat. He will be focusing on the health aspect, hence the name Dr. Jeff. Right? There we go. So one of the biggest questions that I get, and I don't even know fully the complete answer, although more and more, the more time we talk about it, the more I research, is what is the difference between functional medicine and then the traditional medicine that we've all known and grown up with?
So functional medicine is just another paradigm within medicine. Most people will think of medicine as Western medicine, but there is Eastern medicine, there's Western medicine, and functional medicine tries to bridge that. It is an integrative approach to medicine, it is a personalized approach to medicine, and it's really bringing the whole picture, both science and art of medicine, to meet the patient where they're at and just achieve the greatest health possible.
Oh, I love that. I usually say they married each other and had a child, and that you say it much more gracefully. So what would someone expect coming to see you that they might not necessarily get when they go to see their traditional doctor?
So functional medicine really focuses on the complex and chronic disease. Western medicine has done a great job with trauma, with acute care, ICU care, emergency room. Stellar. I want those doctors when I see them. But when it comes to these diseases that are complex, chronic, and lifestyle diseases, you need a more holistic picture, something that addresses all that. A majority of the patients seeking out functional medicine do have very long lists of problems and are quite complex. An average or stereotypical encounter with a functional medicine provider is going to be a very long intake, an hour in which, or more, or less, that the patient tells their story. They get a listening provider. It does not have to be a physician. It can be a chiropractor, a nutritionist, a nurse practitioner. So it is very integrative as a whole and team-oriented. But listening to that story, telling that story back to the patient to make sure that they were truly heard, listened to, and understood, so that you can identify where are the areas where health is not thriving. And so it is a collaborative partnership between the provider and patient to address these deeper issues.
That is a big deal. Myself, from my car accident and suffering with chronic pain, and my doctors were amazing in that beginning part, but there was a time when they just said, there's nothing else we can do, it's out of our scope, and I had to move into this other world and be speak for myself and kind of figure it out. So if I had met you, well, actually I did, and he's guided me, but I knew about that and had a provider like that. It might have been a much easier road for me during it. So I think for me personally, that is the big difference. I see both are extremely needed in this world. They serve two totally different purposes. So I am glad you were on this journey, and I'm glad we are able to benefit from that, especially during my arrival. And don't forget, space is limited. It's limited. You don't want to miss this guy. And your time with him will start the moment that you register. So you do not have to wait till May. You can start right now getting that one-on-one, focusing in on how this will benefit you and how it's different from what you're traditionally used to, so that you can come to that event fully prepared and be fully ready to arrive into your greatness. And thank you, and we will see you soon.